Hi, everyone. I'm Michelle Leifer, and I'm the director of the Usdan Institute for Animal Health Education at the Animal Medical Center. Thank you so much for joining us for tonight's webinar, Recognizing Medical Emergencies in Pets with Dr. Carly Fox. So even under normal circumstances, it's incredibly distressing when our pets become sick or injured. And all of that obviously feels heightened right now in these very uncertain times. But we want everyone to rest assured that AMC will be there for you and your pet. And we've taken extensive precautions to ensure the safety of everyone who comes to the hospital. And now I'd like to introduce tonight's speaker, Dr. Carly Fox. Dr. Fox is a staff doctor in AMC's Emergency and Critical Care Service, and we're so grateful to have her here with us to lead tonight's event. And without further ado, Dr. Carly Fox.
Hi, everyone. I'm just gonna bring up this presentation. Excellent. Okay, how's that look?
Good.
Okay, excellent. So today I'm gonna talk to everyone about the top reasons to bring your pet into the veterinary ER. I tried to break this down into body systems so that I didn't really miss everything and tried to be as comprehensive as possible. So let's get started. The first thing we're going to talk about is pets that have respiratory compromise and what that means and what degree of respiratory compromise warrants an ER visit. So cough is something that dogs and cats do fairly frequently. Anytime your dog or cat has a new cough, I think that that's definitely a reason enough to bring your pet into the emergency room. Coughing in pets is abnormal. It can be caused by many, many different causes. And if your pet is having a new cough that you've never heard before, that's definitely something to be concerned about. If that cough is accompanied by an increased respiratory rate and effort, if your pet is coughing up mucus, blood, or fluid, if that cough is associated with a change in frequency or severity, or if that cough is so severe that your pet is unable to rest or sleep, that's all very much reasons to bring your pet into the emergency room. If your pet is has a known cough, like let's say you have a Yorkie that has a history of tracheal collapse and your pet will cough intermittently, but is otherwise doing very well, has a normal attitude, and that cough remains basically stagnant in the frequency and severity, obviously you don't need to bring your pet to the ER every time it coughs because we know it has a condition. However, conditions can worsen over time, or there can be some sort of acute exacerbation of a condition. So if there's a change in frequency of severity of a known cough, that's definitely a reason to come in. Always, as doctors, in order to determine what's abnormal, we need to know what's normal. And that's something that I think all pet owners should know at home. So if your pet has an increased respiratory rate, you obviously need to know what a normal respiratory rate is for your dog or cat. And the best way to measure that at home is to measure your pet's chest expansions in 10 seconds. So watch your pet breathe at rest for 10 seconds, count them, and then multiply it by 6. Sometimes it's hard to actually see your pet's chest expanding. So if you want to put your hand on your pet's chest, that's another way to sort of count how many in 10 seconds. And then multiply that by 6. And what's normal is about 20 to 30 breaths, 35 breaths per minute at rest. Of course, if your dog just goes to the dog park, comes in and is panting excessively, we obviously have a reason for that. So don't read too much into that. But when your pet is lying down and their respiratory rate really shouldn't exceed 35 breaths per minute. Anytime your pet has any new upper airway noise. So animals, when they breathe, they should breathe relatively quietly. The only exception to this really are dogs and cats that are brachycephalic. And what that means is that dogs and cats that have sort of flat faces, these are French bulldogs, pugs, Persian cats. Oftentimes, owners of these pets are comfortable with their animal having some degree of respiratory noise. But if your pet is a silent breather and it's not any of those breeds, and they start with a new respiratory noise, that is something to be concerned about and perhaps bring your pet into the emergency room. If you have one of those dogs that has a known sturdor, like a bulldog, and that sturdor has changed acutely at home, that's also a reason to bring your pet into the emergency room. If your bulldog, you go around the block with your bulldog on a sunny day and you come home and you notice that that noise is extremely loud and they seem distressed, that is a reason to bring your animal into the emergency room. Cats should really never open their mouth to breathe. If you think about cats normally, their mouth is always closed, and cats are what's considered obligate nasal breathers. Horses are also considered obligate nasal breathers, where they just prefer to breathe out of their nose rather than their mouth at all times. Open mouth breathing in cats can be seen in times of stress. It can also be associated with respiratory disease, metabolic disease, neurologic disease. So if you notice that your cat is open mouth breathing at home, absolutely bring them in, because that is definitively abnormal. Okay, GI upset. So I would say gastrointestinal upset is the most common emergency that we see. Vomiting is extremely, extremely common in our pets. I'm sure you know, being pet owners. So I think it's really difficult to know, like, wow, my dog just vomited. Should I bring him in? Is he sick, or is he just being a dog? And it's difficult to say. And I think sometimes history and then looking at your pet is super important. So if your pet, I would say, vomits 2 to 3 times in one day, to me, that's a reason to bring your animal into the emergency room. If that vomiting is accompanied by inappetence, if that vomiting is accompanied by diarrhea, if you know that your dog just chewed up a plush toy yesterday or 3 days ago and now your dog is vomiting, that's a reason to bring your pet into the emergency room. If your dog or cat vomits once and is otherwise happy, running, playing, eating, and just being himself, you can probably watch and wait. But if that vomiting becomes profuse, and by profuse I mean, I would say about three plus times, then your pet should be seen. Diarrhea is also something that is extremely common in the emergency room. I'd say that's probably our #1 complaint in an animal coming to the emergency room. And again, it's really hard to know, does my pet just have diarrhea and he'll get over it, or do I need to come in? I think it's something that we more commonly see in dogs than in cats, but obviously we can see it in both animals. So with diarrhea, anytime your pet has bloody diarrhea, it should probably come into the emergency room. Usually bloody diarrhea, it looks much worse than it actually is, but it can be serious, especially when small dogs have profuse bloody diarrhea. It can also be associated with parvovirus, which is a very serious viral infection in young dogs, or be associated with hemorrhagic gastroenteritis, which can sometimes require intensive care. If your pet is happy, wagging, eating, and has bloody diarrhea, it should still be seen. But definitely, if your pet is not acting himself, if it's accompanied with vomiting, it should be seen on an emergency basis. Also, if the diarrhea is dark and tarry, that's also something that should be seen on an emergency basis. Dark and tarry stool is often indicative of melena. Melena is seen when there is bleeding within the gastrointestinal tract, usually higher up in the gastrointestinal tract, and can be indicative of many different conditions in dogs and cats. So if your pet has consistent dark and tarry stool, it should be seen. If your pet has formed stool that looks dark and is otherwise acting normally, you probably don't need to rush in. But if it's diarrhea-like and consistent, and you also notice that your pet is not feeling well, it absolutely should be seen. If your pet is having any drooling or excessive swallowing or drooling, absolutely come in. If your pet has prolonged inappetence, come in. And by prolonged inappetence, I mean about 1.5 to 2 days of inappetence. If your dog or cat just doesn't eat for 1 day and is otherwise generally acting normally, I would say schedule an appointment with your regular veterinarian within the next 48 hours if you can. If that inappetence is associated with other signs like vomiting, diarrhea, your animal has a known chronic medical condition like diabetes or chronic kidney disease, obviously you should be seen sooner rather than later. But if you have a otherwise healthy animal that just doesn't eat for 24 hours, you can probably wait and see and schedule an appointment with your regular vet. If your animal is exhibiting non-productive retching, that is always an emergency, and your pet should always be seen. Retching can be associated with several conditions. However, the most life-threatening one that we think of associated with retching is gastric dilation and volvulus, or a GDV. This is a life-threatening emergency, typically in larger dogs, and it requires aggressive fluid therapy and is a surgical emergency. And animals can get super, super, super sick, and the time when signs are noted to the time of emergency care can oftentimes be prognostic for them. So it's very important that they come in if your dog is non-productively retching. Of course, if your cat is non-productively retching, same thing, but it's more commonly seen in dogs. If your pet has a distended abdomen, this is one that you can it can go either way. If your pet has a distended abdomen and is having some other concurrent sign below, like vomiting, diarrhea, inappetence, weight loss, collapse, or lethargy, it should probably be seen. If your pet's abdomen looks a little bit more distended than usual when you're just looking at him being normal at home, you can probably schedule an appointment with your regular vet. Abdomens can become distended for many, many different reasons. Even after just a large meal, your animal's abdomen can look distended to you. And I think as pet owners, we sometimes overread this sort of non-specific clinical sign. But if your animal's abdomen looks very large compared to normal, and it's accompanied with one of these signs, you should come in on the emergency service, but oftentimes it can wait to see a regular vet in the morning or the next day. Okay. Toxin ingestion. Dogs and cats are fairly indiscriminate eaters, so they will get into things that they shouldn't all the time. And this is a very common complaint in the emergency room. If your pet ingests rodenticide, it is very important that you come into the ER. This is not something that you want to watch and wait for at home. It's something that should be addressed immediately. Knowing the type of rodenticide is extremely important. If you have access to that, that would be very helpful. There are 3 mechanisms of action in which common rodenticides in the United States work, and it's really helpful for us as emergency clinicians to know what type of rodenticide it is, because these are treated very differently. So if your pet gets into rodenticide, please come in as soon as you think that has happened, and also try to figure out which type of rodenticide it got into. Chocolate is something that I think most people are aware of. Dogs and cats should not ingest chocolate. But what I think a lot of people aren't aware of is that the type of chocolate and the amount of chocolate is very significant. So there's a big difference in treatment between a Chihuahua that ate a bunch of baker's chocolate versus a Great Dane that ate like a chocolate cupcake. Obviously, the Chihuahua would be much more severe if it ate a more concentrated form of chocolate. So if your pet eats chocolate, please try to figure out what type of chocolate it is, approximately how much they may have eaten, when, and also to know your pet's weight offhand. If you call us or call your regular vet, or if you call the ASPCA poison control, that's really helpful in order to figure out the toxic dose that your pet may have gotten into. You can always call the emergency room to figure out if emergency care is needed. So if that Great Dane owner called me, which we get this phone call all the time, was like, my Great Dane ate 2 chocolate cupcakes that were on the counter, I would honestly tell them not to come in. There's not a significant amount of chocolate in that in order to warrant emergency care. That's usually something I would recommend that people just keep an eye on their pet. Most likely the worst thing that'll happen is that they get diarrhea. So you can always call us if you're unsure. Tylenol, NSAIDs such as Aleve, Advil, ibuprofen, carprofen, or Rimadyl, which is a commonly prescribed nonsteroidal anti-inflammatory in dogs, Metacam in cats. Any ingestion of any of these human medications or an excessive amount of the prescribed veterinary medications, it is very important that your animals come into the emergency room as soon as possible. The sooner the better, and the biggest thing with these cases is to try to decontaminate your pet and try to get those human medications out of their body as fast as possible. So coming in the next day is not very helpful. Coming in as soon as possible is extremely helpful. And knowing the amount, the milligrams of the pills and perhaps how many they could have eaten is also very important. And any NSAID ingestion in dogs and cats should be seen on an emergency basis for sure. Xylitol, which is most often seen in sugar-free gum. That's another thing that should be seen very immediately. Xylitol is absorbed rapidly through mucous membranes. So as soon as your animal chews on that xylitol that was in the gum is already in your pet's bloodstream. It's super, super fast acting. So even if we make them vomit, which we often will if it's in a short period of time, we still treat them as if they ingested a fair amount of xylitol because it's so fast to be absorbed in the bloodstream, and it's can cause hypoglycemia or low blood sugar, and has been known to cause idiosyncratic liver disease as well. So it's something that should be treated. Grapes and raisins, also in dogs, not seen in cats, but in dogs that ingest grapes or raisins, these can cause an acute kidney injury. And what's interesting about grapes and raisins is that it's an idiosyncratic reaction, meaning that one grape or one raisin can cause an abnormal reaction in some dogs and maybe not others. Some dogs can be eating grapes their whole lives and be completely fine. Other dogs can get into, one piece of raisin bread and be very sick. So we will always tell you to come in. So if you call and you're like, my dog, he ate one grape, I don't know, do I need to come in? Unfortunately, the answer is going to be yes. And it's going to something that's going to need treatment because we're unable to tell if your dog is which category your dog is going to fit into. Lily ingestion in cats. Now, this is also something that is a true emergency. If your cat ingests any part of the lily, meaning the leaf, the stem, the pollen from the lily, even if they drink the water that was in your lily plant, lilies are super, super toxic to cats, not to dogs, but just to cats. And it also causes an acute kidney injury and can put them into very severe renal failure very quickly. So as soon as your cat ingests any part of a lily, it should be seen on an emergency basis. And I think what's interesting about our animals is that they don't care what they're eating, they'll get into whatever. And we, as emergency doctors, we've seen so many things, but we obviously haven't seen everything. So if you're unsure if what your pet ingested is harmful, you can call us and maybe we have seen it, but if we haven't, we will ask you to call the ASPCA Poison Control because they are the authority on everything and anything. They have 1 million cases from around the country and have data on everything. So if you're unsure of if what your pet ingested is harmful, please call them, and you can call us. And if we're not sure, we'll tell you to call them. And we're doing that because perhaps veterinary emergency care isn't even needed. And it's a really good number to have in your phone or available. And if you can always look it up on the internet, but there's several poison control numbers on the internet, but this one is definitely the one that we refer to the most. So this is the phone number. I think it's good to put in your phone and have it just in case there is an emergency and you need to access it. And they're wonderful, and they're open 24 hours a day, 7 days a week, and you will speak to a veterinary toxicologist, which is pretty amazing. Okay. So urogenital and reproductive abnormalities. Again, something that we see very commonly in the emergency room. I think a lot of people who have dogs and cats have experienced this maybe. Their cat or dog is having some straining in their litter box. Perhaps they're producing bloody urine. Perhaps they're urinating outside the litter box, or your dog on the walk is urinating many, many times and there's very small puddles of urine coming out, or eventually straining with nothing coming out. And in most of those cases, honestly, in dogs, it's oftentimes associated with urinary tract infection. In cats, it can be associated with urinary tract infection in female cats. Urinary tract infections are pretty rare in male cats, but they do develop this lower urinary disease called feline lower urinary tract disease that looks like a urinary tract infection. Bladder stones can also cause this, and in rare cases, bladder or urethral neoplasia or cancer can cause this. So if your animal is straining to urinate or has bloody urine but is still producing some urine, your animal should be seen by a veterinarian. It's not necessary 100% that you come in through the emergency room if you're able to get an appointment at your regular vet within, I would say, 24 to 48 hours. However, if your pet is straining, and there is no urine production, that's a different story. And that's when your pet absolutely needs to come to the emergency room. I would say this if your pet is straining and there's no urine production within 4 to 6 hours. If your pet is straining and producing small amounts of urine and then all of a sudden is straining and nothing's coming out, that's probably just because they peed it all out. But if there is no urine production or very little urinary production, or if your pet is also having vomiting, lethargy, is crying excessively, associated with straining and no urine production, it absolutely needs to come in to the emergency room and be evaluated. If your cat, in cats, that feline lower urinary tract disease that I described before can progress to a urethral obstruction where there is a blockage in their urethra and they're unable to expel urine. And this can lead, not only is this extremely uncomfortable if you think about it, but it can lead to significant electrolyte derangements, which can be life-threatening. So especially in cats, your cat should be seen immediately. This can also be seen in dogs, but it's usually something that is less acute in dogs. But either way, your animal should be seen on an emergency basis. Okay, so this is an interesting one. No urine production in 12 to 24 hours. I think this is something that it's a complaint that we see in the emergency room sometimes. They're like, well, my dog, he's acting normal. He's normal, he's just himself, he's eating, no vomiting, he's totally normal, but I haven't seen him pee in 12 to 24 hours. Now, you know, that's like a weird thing. You would think that there would be something very, very wrong. But in a lot of cases, I think we're just missing that they're urinating somewhere. Perhaps they're urinating in the house and we're not seeing it, especially with cats. They have a lot of inappropriate urination. Maybe they're urinating in the tub or in the closet. And they're otherwise acting normally. This is something that you can probably make an appointment with your regular vet for within the next, 1 or 2 days. If you have a dog, I would just recommend walking them more often and seeing what they do. Of course, this is not associated with straining. This is just your animal. You just haven't seen it pee in a period of time. If there is no urine production and your animal is also having vomiting and diarrhea, if your animal is inappetent, lethargic, has non-urinary disease, then obviously come in. But if your animal is a healthy animal and you just haven't seen your cat use the litter box in 12 to 24 hours, but is otherwise acting normally, I would probably look around your house and see where else they're peeing and make an appointment with your regular vet just to make sure. Paraphimosis is something that we see in male dogs, and what that means is the inability for a male dog to retract its penis back into its prepuce. This is something that's usually seen after a mating or humping behavior, and their penis just won't go back into the prepuce. And the reason why this could potentially be dangerous is that their penis can dry out and can become infected. That tissue, it needs to be moist to be healthy, and it can become necrotic or very diseased in a very short period of time if it's not in this protective case, which is its prepuce. Also, your dog will immediately start licking at it, making it even worse and more prone to infection. So if you notice that your male dog's penis is outside its prepuce for an extended period of time, and by that I mean probably more than an hour, it needs to be brought in so that we can put it back into its prepuce. And this is usually something that's very easily done, but needs attention. If you have some sort of lubricant at home, like KY jelly or Aquaphor or something like that, you can put it on your pet's penis on your way into the emergency room. But definitely it should be seen, so just to make sure that drying out and necrosis doesn't happen, because it sometimes even needs a surgical procedure to fix, which is terrible. So vaginal discharge is always abnormal in pets. The only exception is if your animal just gave birth and is going to have vaginal discharge for several weeks afterwards, which is normal, just like in women, but vaginal discharge not associated with a recent birth is completely abnormal. So if you notice that your female dog or cat has vaginal discharge, it absolutely needs to be seen. Sometimes this can be associated with a very bad urinary tract infection. Sometimes it can be associated with a superficial skin infection or vaginitis, but it also can be associated with something called a pyometra, which is a life-threatening infection of the uterus that is a surgical emergency, and it's something that we see super common in the emergency room. And if you notice your animal having vaginal discharge, just please bring it in and we'll figure out the cause. Dystocia means difficulty having birth. So If you have a pregnant dog or cat and they are having trouble giving birth, that is obviously a reason to come into the emergency room. I think if you're not familiar with what that looks like, if your pet got pregnant accidentally and you're not sure, so it's defined as active labor with no puppy or kitten within 1 to 2 hours. So if your pet is having active abdominal contractions and there is no production of a puppy or kitten within 1 to 2 hours, your pet needs to come in to the emergency room and or in between puppies. So if your animal is able to birth a puppy now and then it's having contractions and you don't see a puppy for an hour to 2 hours, that's a problem and it needs to come in. But what's even better to make sure that this does not happen is to spay and neuter your pets. So please go that route instead of waiting for the dystocia coming in, because oftentimes your pet, we need to do a C-section in a lot of cases. Sometimes it can be managed medically, but more commonly it's managed surgically. Obviously, the longer time your pet's in distress, the worse for your pet and also worse for the puppy or kitten. Okay, neurologic abnormalities. We commonly see animals that have seizures. This is something that can affect young and old animals, both dogs and cats. Seizures are abnormal. Seizures are uncontrolled electrical activity of the brain, and they can look differently in different animals. But any seizure is abnormal. So if your pet has a seizure, bring it into the emergency room. It's amazing how many people will tell me that their animal has had a seizure last week and it was the first one and they just waited to see if it had another one or didn't think anything of it. But I mean, to me, that is extremely abnormal and it should not wait, and your animal should be brought in for evaluation and to do at least preliminary blood work to make sure that there is an underlying systemic disease. So any new seizure is a reason to come into the emergency room. As a pet owner, I think when your animal has a new seizure, you sort of freak out because you're like, oh my God, what do I do? I've never seen this before. It's obviously very stressful to your pet and also to you. But if you can, at any time during your animal's seizure episode, if you're able to record it, it is extremely helpful to us in the emergency room. It is gold for us to be able to see it, because sometimes things to you look like a seizure and perhaps aren't. So it's very helpful for us to further characterize the episode that your pet had at home. So try to take out your cell phone and get a picture, get a video of it if you can. If your pet has a seizure history, meaning that your pet has known seizures, is being seen by a veterinary neurologist, has a history of epilepsy or other causes of seizures. If your pet has more than one seizure in 24 hours, that is a reason to bring your pet into the emergency room. If your pet has a seizure that does not stop or is very prolonged, that is a reason to bring your pet into the emergency room. However, if your dog is a known epileptic and you know that your dog has a seizure once every 4 to 6 months, and you look and the last seizure your pet had was 6 months ago and now it's having one again and it recovers okay at home and the seizure follows the book that your dog wrote, there is no reason to come into the emergency room. You can call your regular veterinarian or your veterinary neurologist and see, but typically our goal with seizure management as veterinarians is to decrease the severity and frequency of seizures, not to eliminate them completely. So if your animal, your cat or dog has known seizure history, they'll probably seize intermittently, even on medications. And we just need to know that their frequency is either increasing or remains the same, but there's no reason to bring your animal in with a known seizure history that just has a seizure on schedule, basically. If your animal is not able to walk, is dragging his or her limbs, obviously that's a reason to bring your pet into the emergency room. It can be very serious. If your pet is walking and falling over, is stumbling acutely, that is also a reason to bring your pet into the emergency room. This can be caused by intervertebral disc disease. It can be caused by a stroke, inflammatory disease, even cancer. We just need to see your pet immediately and do a bunch of diagnostics in order to try to figure out what's actually causing these abnormalities in your pet, but definitely bring your pet in if it's exhibiting any of these signs. If your animal develops an acute head tilt or turn, plus or minus nystagmus, which is a rapid uncontrollable eye movement, that's also a reason to come into the emergency room. This can be due to something relatively benign, like a inner ear infection, or it could be due to something very serious like a stroke, or some sort of intracranial disease like a brain tumor, etc. But it absolutely we need to look at your pet, do a neurologic exam, and sort of figure out, which path your animal is going on. So if you notice any of these things, please bring your animal into the ER. Should not wait. Okay, trauma. In New York City, trauma is something that we see daily to the AMC emergency room. Some examples include, a dog that got hit by a bike or a car, a cat, or even a dog that has fallen from a height. The most common thing that we see that fits into this category is a cat that fell out of a window. When the starts getting nice out, especially now in springtime, people are opening up their windows and their cats are curious, and unfortunately sometimes they fall from pretty significant heights, and we see them after that, or people come home and they can't find their cat. There's an open window and then they're found later that day or even the next day. Those are all things that are very commonly seen through our emergency room. Lacerations should always present as emergencies. It's amazing how many people, watch and wait for cuts on their animals that either they caused or, happened from some sort of traumatic incident elsewhere. But especially now that we're on quarantine, I think people are looking at their animals and being like, I can groom him. I'm fine. I can do it. And they use scissors, which most groomers will use a combination of scissors and clippers. Clippers are way safer. So if you're going to try to groom your animal at home, please elect to use clippers and leave the scissors to the professionals. But it's amazing how many people will accidentally cut their animal with scissors. So anytime that happens, and no judgment, we just want to see your pet and treat the laceration. And please don't wait, because if you do, that laceration will get infected. And then it'll become a much bigger problem than if you were to just come in immediately. So please, any laceration, please come in. Bite wounds, same thing. If your pet gets into a scuffle at the dog park and you notice that your pet has bite wounds, please come in. The sooner the better. There is a window of time in which, if we clean it and treat it appropriately and flush out a wound and put your animal on antibiotics, the chance of infection is extremely low. If you wait until the next day, that chance of infection goes up tenfold. So please, if your animal has a bite wound, don't just keep an eye on it. Please just bring it in, and we will clean it for you and administer appropriate therapy. Of course, any fracture should be seen on an emergency basis, just like if you were to have a fracture for whatever reason. Escalator injuries are a very specific injury that we see very commonly in New York City. I think people bring their animals to department stores that have escalators, and they think it's cute when their Yorkie rides beside them on the escalator. And it is for a period of time until their Yorkie's little paws get caught in the escalator when at the end of the escalator. And people never expect this to happen, of course, and they think that their dog will just hop off an escalator like a person would, but dogs don't know what escalators are. And even if they do, they're not wearing shoes and they're just exposed. So it is a major, major injury that can happen to your animal's paws, and it causes major, major tissue damage that usually requires surgery, oftentimes even digit amputations, etc. And it is very, very avoidable. So if you are, please use the stairs or use the elevator, or please pick up your small animal and don't put them on an escalator, because it can be very serious. Torn nails can sometimes there is sometimes a reason to come in on the emergency service if your animal has a torn nail. If your animal has a torn nail and the bleeding has stopped, you can probably wait and see a regular vet, within 48 hours. If your animal has a torn nail and the bleeding has not stopped, or if your dog or cat will not allow you to put pressure on them or touch them, that's definitely a reason to come in, and we're happy to see you. It's a very quick, easily treated emergency, but it does usually require a little bit of care through the ER. The biggest takeaway, I think, for trauma is that internal injuries may not be apparent for a significant amount of time after trauma. We usually tell people 12 to 48 hours. So sometimes a dog gets hit by a car and they run away and they're like, oh, my dog looks normal. He ran away, he's fine. And hopefully in many cases that's true, but in also many cases that's very untrue, because there can be very significant injuries going on internally that you wouldn't be able to perceive until your animal is very, very sick at home. So please, even if your dog or cat looks normal after a traumatic incident, it's better to bring them in to be safe rather than sorry. And we're happy to do a bunch of tests and make sure that your animal looks okay and that we're not missing anything. Okay, ocular emergencies. So we see tons and tons of eye cases through the AMC ER. People, I think what's commonly seen at home is that their cat or dog is excessively squinting. Perhaps the cornea, which is the clear part of the eye, has changed in appearance. The cornea is that big. Cats and dogs have super big corneas compared to people, and it should be crystal clear. Sometimes if there's an acute change of that clearness to blue, if it looks red or white, that's a reason to come in through the emergency room or to make a quick appointment with your regular vet if they're able to see you that day. Absolutely should be seen. If the eye appears bulging or enlarged, that's also a reason to come into the emergency room. Most the ER doctors at the AMC are very comfortable treating really mostly any emergency eye condition. We also have a wonderful ophthalmologist who elects to consult on a lot of these cases. So if she's available and working that day, she's excellent at consulting, and we work together with her very commonly. So if we're not sure, we usually go to her, and it's a great partnership that we have for ocular emergencies at the AMC. If you think your animal is acutely blind, that's also a reason to come in. Oftentimes, if the eyes look normal, oftentimes this requires a bunch of diagnostics to figure out what the cause of acute blindness is, but we can definitely get started in the emergency room. We probably won't be able to snap our fingers and fix your animal's acute blindness, but we will be able to get started and figure out exactly, why and what's happened and make recommendations secondary to what we see. Of course, if there's any bloody discharge from the eye or within the eye, if your animal has a proptosis, which is when the eye comes out of its eye socket, that's a reason to be seen, of course. This is usually secondary to trauma. However, it can be seen in animals with really very minimal trauma if they have very shallow eye sockets, like pugs, Shih Tzus. Sometimes their eyes can just pop out they jumped off the couch and their eye popped out. So that should be seen in any instance. Okay. Okay, this is the last thing, number 8. So if your animal has any episode of collapse or is unable to get up, that is always a reason to come in through the emergency room. Collapse in a pet can be caused by so many different things. There are such a wide variety of causes, and this is just a list of a few of them. But any of these, there's really no way at home to know what's the cause of your animal's collapse until it's seen by a veterinary professional, because there are so many different causes, and we do need to do a bunch of diagnostics to sort of narrow it down and then institute therapy secondary to that. Prognosis obviously depends on the cause, and these pets always need to be seen. Okay, and perhaps another very important number, aside from the the ASPCA poison control number, this is an AMC emergency helpline that we recently instituted. It's a number that will get you in touch with an emergency critical care nurse or doctor, and we will answer questions if your animal needs to come in. So this isn't a number to call to talk about your animal's like chronic history. It's a number to call and just be like, hey, does my pet need emergency care? So if you're unsure at home, if your pet needs to come in, call this number and we'll help you make that decision. Again, it's open 24 hours, 7 days a week, and someone will always answer it on the other line. So please give us a call if you are unsure if your animal needs to come in. Okay. All right, well, that's the end of my formal presentation.
All right, thank you so much, Dr. Fox. That was really informative and really concise. I think all of us pet owners really appreciate, just how in-depth you went in categorizing the different types of emergencies. And I feel like a lot of people are gonna find this information useful. So just to introduce myself, everybody, my name is Kimberly. I am the Education and Events Associate for the Usdan Institute at the Animal Medical Center. We have a couple of follow-up questions for Dr. Fox, and then we will be taking questions from the audience. If you would like to ask Dr. Fox a question, you can use the Zoom group chat feature. There should be a button that says chat at the bottom of the screen. But my first question to you, Dr. Fox, we went into depth today with dogs and cats, but my first question is, are there certain emergencies that are specific to an exotic pet? So for example, one that you might see in rabbits or one that you might see in birds. Would you be able to talk a little bit more about that?
Sure. So what's great about the AMC emergency room is that we see tons also of exotic pets on top of dogs and cats. And I think all of the ER doctors are pretty comfortable dealing with common emergencies in common exotic pets. As far as rabbits are concerned, I'd say the most common thing that we see is a complaint of the rabbit not eating and or not defecating, or as a slowdown in defecation. And this is characterized as GI stasis or GI gastrointestinal slowing, and it can be caused by many, many different things. But the condition as pet owners, what you need to know is that if your rabbit stops defecating or its defecation has slowed down significantly and or stops eating, that is a reason to bring your rabbit into the emergency room. It's something that can be very, very serious. Even if your rabbit looked totally normal in the morning and then by the afternoon you notice that it's not defecating, serious emergency in your rabbit and absolutely needs to come into the emergency room. Birds, we see lots of birds on the ER as well. Birds are common New York City pets because they can live in your apartment, and they're great pets for people that have years and years to dedicate to them, because birds are a big commitment. They live a really long time. But I would say the most common bird emergencies that we see are birds that are egg-bound or unable to lay an egg. There's an egg like actually stuck in their abdomen and they're unable to lay it. Any bleeding bird is an emergency. Absolutely. Birds have a very small blood volume, and any small amount of blood that looks small to you, to them, that's a lot of blood. So anytime you see a bird that's bleeding, it needs to be brought in. And any bird that's having difficulty breathing needs to be brought in as well. These are, I'd say, the three most common emergencies we see in birds, and they are all definitely very significant emergencies and should seek emergency care. I think exotic pet owners just need to know where to take your animal in an emergency and to know what's comfortable, because not every general practitioner is used to dealing with exotic animals. So you just need to know, is there a place that can treat my animals with experience? And we have a great exotic service and the emergency room works with them. So just make sure to get a local experienced veterinarian for sure.
All right, thank you so much. All right, so our second question is, well, obviously, pet owners, we don't want anything to happen to our pets. So are there any preventive measures that pet owners can take to lessen the chances of an emergency happening?
Yeah, I think that there are. I mean, obviously emergencies aren't there in most cases, they're accidents, and we can't prevent everything, but I think making sure your pet is obviously up to date on its vaccines is something that's very easy to do and be preventative of a very serious emergency, especially in young dogs and cats. And also making sure your pet receives preventative care. Your pet goes to the veterinarian regularly for checkups and routine blood work and routine examinations, because that can prevent a chronic known disease from getting out of hand and just presenting as in a very serious state. Just like in people, you need to go to the doctor every year for your checkup. The same with dogs and cats. I would say, as far as trauma is concerned, never walk your dog without a leash on. And I can't believe how many people I see in New York City walking around their dog without a leash, and they just trust their dog implicitly. And I understand that, but also I've seen way too much. And what I can tell you is that they are still dogs, and they can still very easily get hit by a car and be very, very significantly injured. So please, please put a leash on your dog, and perhaps not even that, but your dog can get attacked by another dog, or your dog can attack another dog. And it's harder to remove your dog from that situation if your dog is free and not on a leash. Also put screens on all your windows, sort of in the same vein. We're opening our windows at this time when the weather's starting to get nice, but if your windows have screens, it makes the chance of your cat or dog falling out of the window much, much less likely. And of course, always just like, don't wait, just come on in. We're open. So if you're concerned at all, you can always call that number, or you can come in, and it's better to be safe than sorry.
All right, and so the last question that we have for a follow-up is, you know, if your pet is having an emergency, is there anything a pet owner should do while on the way to the ER?
Yeah, I mean, I think if you are in your right mind to call your regular vet and get records sent over, that is so helpful to us. If they're like on their way through the, you know, through the internet coming to be put into the record, or you know, your regular vet is expecting a call from us, just so that they're prepared and we have all your pet's records, if possible, by the time that you arrived or soon after you arrived. It's extremely helpful to us, and it gives us more time instead of us calling your regular vet to get those records. So if you're able to do that, that would be amazing. And then I think also just being like mentally prepared to enter a veterinary ER, just like if you were going to a human ER. It is an emergency room and it is unpredictable. Wait times can sometimes be unpredictable. We try super hard to get people out of there as quickly as possible, but you never know what's going to walk in the door. So if your pet is in there for a mild problem, it may wait longer than is expected, just based on the amount of things that are going on around your pet. So just a good attitude, and you know, just being mentally prepared that you're about to be in an emergency room. This isn't a scheduled appointment.
Absolutely. All right, thank you so much, Dr. Fox. It looks like we have quite a few questions over in our chat. So right now, everybody, Dr. Fox is going to take a look at those questions. We might not get to all of them tonight, but she's going to go through them and answer some of the questions you have. And obviously, if you had a question that you didn't put, it's in the chat function, which is the button at the bottom of your screen.
Okay. Okay, cool. So from Concetta, I think I'm saying that correctly, says, my dog was limping for 3 days. She's okay now. Could it be arthritis? How do I know if my dog has arthritis? As you guys probably noticed, that limping was not on my emergency presentation. I think we see a lot of dogs that are limping. And in most cases, just like what happened in your dogs, if you rest your dog, oftentimes that limping will improve. If the limping doesn't improve, that's a reason to come into the emergency room or make an appointment with your regular veterinarian. But osteoarthritis is usually diagnosed via radiographs. However, arthritis is usually a diagnosis of presumption in our dogs. If you have a large breed dog, an overweight dog, an older dog that has some difficulty getting up, and by later in the day they look a lot better, oftentimes your veterinarian will assume that perhaps they have arthritis, and you know, sometimes they'll recommend doing radiographs to definitively diagnose it. But just because your radiographs look normal doesn't rule out arthritis, because perhaps there's no bony changes yet. So it's usually a diagnosis based on physical exam, your singlement of your dog, meaning the age and breed, and the history of what you're saying and how they're acting at home. So I hope that was helpful. Okay. From Jessica Wagner, is that phone advice free? It is free. So give us a call. It is free. I guess it probably costs money to call, but aside from that, we're not going to charge you anything. Kate Morth says, how can seizures present in small dogs? Are there calm symptoms that would be considered an emergency? Okay, so seizures can present in small dogs in many different ways. They can present as just facial seizures, whereas their face has this repetitive, very acute movement, almost like fly biting, or you would look at your dog and or cat and say that there is rapid, uncontrolled muscle movement, and it is
persistent, and that is very odd. It can present like that, or it can present as full tonic-clonic, full body seizures where your animal actually becomes lateral recumbent, is unresponsive, perhaps urinates or defecates, and goes through a period of time after the seizure where they're abnormal, stumbling around, and not so much themselves. So it can present pretty mild to pretty significant. Either way, a seizure is a seizure and they need to be seen. Are there COMS symptoms that would be considered an emergency? Definitely. COMS is something called COMS is an abbreviation of a syndrome called caudal occipital malformation syndrome. It's fairly complicated syndrome that's seen in many different types of dogs. I'd say the most classic type of dog that develops this is the King Charles Cavalier Spaniel, but can be seen in many different breeds of dogs, where basically their brain is almost like smushed between the back of their skull. I think that's the simplest way of putting it. And sometimes that can cause increased pressure within the brain and in their spinal cord even, and can be very uncomfortable. It can cause them to develop very abnormal neurologic signs or pain, and it can definitely be considered an emergency. If your animal is a dog with presumed or known COMS, and there is an acute change in the way that your dog is walking, is painful, is holding his head or neck, it should be seen on an emergency basis. Okay. Hold on. Okay, so Emily says, how do you know vaginal discharge in a dog is from the vagina, not from leftover pee discharge from the urethra? Yeah, so I would honestly wipe it away. First of all, if it looks like urine, it's probably urine. And if your dog just recently went to the bathroom, or if your dog is laying down and there's sometimes little puddles of urine, or your dog has like a mild incontinence, you know, it should smell and look like urine. You can take like a paper towel and see what it looks like on a paper towel. It should look like dilute urine or smell like urine. If the discharge is bloody, if the discharge is purulent, meaning almost like white and like almost snotty, that is very abnormal and your animal should be seen on an emergency basis. If it smells very abnormal, like an infection, like you would smell on yourself and be like, oh God, that smells very abnormal. Same thing. It should be seen on an emergency basis. If it's like persistent, goopy discharge, emergency for sure. But I think you should be able to, and I'm sure you can differentiate between urine, which is obviously very clear and fluid, versus like thicker, sort of bloody, gross discharge. Okay. Okay, Helene says, my boy did a dry heave vomit once and nothing came out, but that was only once in one day, and another time a few weeks ago. His stomach is soft. I'm assuming there's nothing I need to worry about. Yeah, that's true. I would say if there are prolonged periods of time in between very acute episodes that are singular, I would probably just do nothing and watch and wait. If your animal, if the frequency of those episodes increase, if your animal actually starts bringing things up, if it's accompanied by inappetence or any sort of abnormal behavior, it should be seen. But what you're describing sounds like just regular, your dog's being a dog or your cat's just being a cat, and it's probably just fine. What exactly to do if you're the hold on. Deanne Romano says, what exactly do you do if the eye pops out in terms of handling the eye pet? So it depends how bad it has proptost from the eye socket. In some cases, we'll recommend removing the eye. However, in a lot of cases, we actually will replace the eye back into the eye socket and do a procedure called a tarsorrhaphy, where we actually close the eyelids temporarily over the eye so the eye can heal, and the inflammation and bleeding in the back of the eye can be absorbed by the body, and that eye actually goes back in place. Unfortunately, oftentimes after incidences like this, the animal is blind, but the eye itself looks very normal, or it can have a mild strabismus or looking to the right or something like that. But generally, the animal is comfortable and the eye looks normal, and animals that are blind in one eye do excellent at home, and most people won't even notice that. As far as their animal's quality of life, it's very, very good. But in some cases, if it's very severe, we'll actually recommend removing the eye for sure. So it just depends on how it looks. Okay, Nazir says, after playing with my dog, she starts to bite the ear and sneeze. Should I be concerned? No, I mean, to me, that sounds like that's just her playing. If it's always after you guys interacting and playing, if that air biting happens completely randomly, not associated with playing, the best thing to do, I would say, is videotape it and show it to your regular veterinarian, or you can make an appointment with our veterinary neurologist and show it to them then, but I'd probably start with your regular veterinarian, because what you're describing sort of sounds just like behavioral rather than a true neurologic problem. Okay. Okay, Diana says, how should I keep my dog's ears clean if he can't get regularly groomed lately? He's a Maltese and has a history of ear infections. Should I leave it alone or regularly clean it? So if your dog will allow you to clean his ears, which some dogs won't, but some dogs are absolutely will, it would be great if you could clean your dog's ears once a week. You can buy an over-the-counter ear cleaning solution on Amazon or Chewy. And if you actually Google, or on YouTube, videos on how to clean my dog's ears, there are actually very amazing videos that teach you how to do it at home, and you can start there. So if your dog will allow you to clean his ears at home, definitely purchase that ear cleaner online and look at the videos in order to how to extend the ear. Dogs' ear canals are shaped like an L. People's ear canals are straight. Dogs are like this. So you do need to pull the ear up and out in order to straighten out that ear canal to make sure that the cleaning gets a little bit deeper in the ear canal, but it's very easy to do. And if you use cotton balls or Q-tips, you should be able to do a good job at home, honestly. Hold on. Okay, Holly would like to just let everyone know that there are ambulance and animal services that could come in handy in an emergency at home, and that's true. I would say the most common animal ambulance that we use and see through the ER is AmbuVet, and we are very familiar with the technicians that run that ambulance service, and they're wonderful. You can Google their number, and they're available all the time, and they call us before they come in just to let us know that they're coming, which to us is very helpful. Okay. So Talia asks about poisonous plants and flowers for cats. Lily, is that a white or purple flower? Is it the white one often used for funerals? There is another plant flower that is commonly houseplant with delicate white flowers that is also poisonous. There are hundreds of poisonous flowers and plants for animals. And what's awesome is that the ASPCA has a list actually. So if you're curious, you can Google it. And if you go to the ASPCA's website, they actually will comment if it's poisonous or not, and what signs you would expect to see at home. And lilies, there are so many different varieties of lilies. I usually just tell people lilies are toxic, and in most cases they are, but there are a very few species of lilies that are less toxic or not toxic, but in general, lilies are toxic to cats, and I would just, your animal should be seen. And I'm pretty sure the lilies that you're speaking of, those that are commonly at funerals, the white ones are toxic to cats for sure. The ones that are at bodegas in the city, those purple lilies, toxic to cats. So don't ever buy those at bodegas if you see them. Okay. Okay, Beth Bernstein asks, her dog was seen by a vet 3 times and all the tests were normal, blood and x-rays, but is still having problems with licking, yawning, swallowing, and sneezing for a month. She has acid reflux and might have some allergies. Do I need to do more? She can sleep comfortably, but she's also acting weird. Totally. So, I think starting out at your general practitioner is always the way to go in the beginning of getting diagnostics tests done. It sounds like they did great general tests, but what's great about the animal medical center is that we actually have specialists that can help with cases in which the diagnostics have been normal and you just, as a pet owner, know that there's something wrong. So I would recommend making an appointment with our internal medicine doctors to further investigate if something is wrong, and they will definitely be able to figure it out if there is something. Hopefully not, but if you as the pet owner think that there is something abnormal with your animal, we never want to overlook that, and I would make an appointment with our internal medicine specialist. They would be the ones to see to further investigate all of that. Oh, also, are deep-throated loud meows a call for alarm of pain in a cat? It sounds like a sheep bleeding. Most, I mean, it depends what it's associated with. As some cats, some cats, every animal is different, just like kids are different, and perhaps that's your cat's way of communicating, but it's also possible that they're uncomfortable, because definitely meowing can be associated with discomfort in cats. But if your cat is otherwise acting normally and just randomly cries out, it could just be them. I don't know is the answer. It can be associated with discomfort in cats for sure, but not always. Kathy says, if a cat suddenly starts walking in a circle and repeats this behavior, what might be the cause? Is this serious? If your cat is walking in a circle consistently and cannot walk in a straight line or can only turn in one direction, then it is something that needs to be investigated. If your cat is just walking in circles and then goes about being normal in between episodes of walking in a circle, it's probably behavioral. But if it's persistent and your cat can't walk in a straight line or can't turn the other way, then it should be investigated. Yeah. Oh, Zora says thank you. You're welcome. Okay. What time is it?
It's almost 7. This is Michelle. I just have a quick question. Hi.
Hi.
Just to cover, because I think when these things happen, people panic and there is a tendency to want to resolve it yourself. So if your dog is choking on something, or you want to, resolve it yourself, but obviously you don't want to waste precious time. So if you could talk a little bit about that, you can make a situation worse. Don't waste precious time. Yeah.
No, for sure. I mean, obviously, I think in most instances, timing is extremely important. The sooner that we see your pet, the sooner we can help your pet. Also, a lot of the times I'll see an animal and let's say it did have some sort of choking episode at home. And then by the time you bring it in, the dog or cat is normal, like the most normal animal ever. And in a lot of the cases, I'll say after examining your pet, I'll say, we could do nothing. Actually, I've examined your pet and everything looks okay. Or we could be extra cautious and let's say do x-rays of your animal's chest to make sure there's nothing caught in the esophagus. So I feel like always we're not going to do things that are unnecessary. And we will, if your animal had an acute episode and now is normal, especially in that case, I would give you the option of just watching and waiting at home or visiting your vet in the morning. So I don't want to waste your time, your pet's time, my time, anyone's time. So I think we're pretty reasonable when it comes to that. We're super busy, so we just want to give the best care, give you the best options, and move on.
Good. No, that's great. That's great. All right. Well, thank you so much for joining us. This was wonderful and super informative. And like I said, again, thank you. And thank you, everyone. Everyone stay healthy. And we, again, appreciate your trust in us at AMC and you for joining us tonight. Okay. Thank you. Bye-bye, everyone.
Thank you.